welcome to Let's Achieve Part 3 in One Go. It is clearly depicted that we have to do this exam in one go. So everything we are going to talk today in all further sessions are only with the target of passing this exam in May, right? So are you ready for that? Everybody okay?
Yes, ma'am. Hello, ma'am.
Hello. Yeah. Good evening. Very good
Good evening,
evening.
ma'am.
Yes. Great. Okay, so all my lovely students, you are back. So it's good to have you all, someone new also. So everybody is welcome. And today in this session, we are going to talk about like how we will go about in this preparation for the part 3. Few of the basic concepts are included in this also because many people are fresh also, those who are now starting to prepare. So I have also included some of the basic points and also some of the points like how we will go through and how you can utilize this course to the best. So this is how we are going to talk about in this particular presentation, right? So let's start. In between, wherever you have any questions, you can always stop me and ask whatever is required. So today we are going to talk about part 3 format because always it is very important to understand the exact format of the exam and how we score for the exam, right? Because in that way you are focused on studying those things which you require to pass the exam and not focusing on the all ocean of knowledge. So that is very important that we should know how the marks come to us when we appear in the part 3 so that we are focusing our concentration there. Understanding the marks allocation is definitely very important. What is the preparation strategy ideally should be there and how we can save our time and prepare in 70% less study time. So this is how we are going to talk about in this particular presentation. So as I said, first we are going to talk about the format of the exam. So what are the type of questions we have in the exam? Okay. Till now, in part 1, we were talking of single-based answers. In part 2, everybody has gone through the terror of extended matching questions, that is the EMQs. And now what is the next terror? No, it's not a terror. It's much better than the part 2 exam. Part 2 was a terror, but we tried to make it simple as well, as you all have gone through that. Now in part 3, it is easier than the part 2, right? But part 3 exams require your active participation. In part 2 teachings, you may be sitting at the other end and studying at home. That's quite okay. But for the part 3, I need your active participation. You have to present the cases. You have to speak so that I can make the corrections, right? And you to go on improving and improving till the last day. So this is only possible if you are joining in the active sessions and you are presenting your cases, right? So one thing is very clear, just sitting at home and reading is one part, right? But it may not completely help in the part 3. In part 3, it is all about speaking, speaking and speaking. So what are the type of questions? So we have total 14 stations, in a circuit. What does the circuit mean? You can see like a continuity of the chambers are there and you go from one chamber to another to third to fourth to fifth like this, right? And you have to complete the circle of 14 stations and this complete circle takes 3 hours. So it is 10 minutes is the time where you stay inside the chamber and 2 minutes is the reading time where you stay outside and read whatever the task is provided to you. So total 2 minutes, then you enter, 10 minutes you present the case, you come out, again read for 2 minutes, enter the chamber and present case for 10 minutes. Like this you keep on repeating unless you complete the circle of 14 stations. And this all takes around 3 hours. It is fastest 3 hours of your life, right? You will not even come to know that you have gone through the 14 stations. Okay, it would be so quick. So now when I say that it is so quick, so that means we will not have time to think about anything. So everything should be at our final level, at the level of reflex, right? So that when we enter, we see a task, everything, we just start speaking. It just comes out from the inside. Okay. So now because we have to remember everything like that, that we don't have to think about anything, that means what we need to do is practice. The more we practice, the more we can speak properly in the exam. I'm not saying you can speak more in exam, because speaking more is not just going to give you the marks. It is not going to get converted into marks. The logical talks are going to get converted into the marks. So it is not about talking more. It is about talking right? So this is how the practice is the key concept here. So, and there will be no breaks, no water break, no loo break, no nothing. It's 2 minute, 10 minute, 2 minute, 10 minute, and it's a continuity. And remember, you will not have any timer. Okay, so just don't, from the very beginning, when we start presenting the stations, don't try to put a timer in front of you, because that is one thing which is not going to help you, because in exam you will not have a timer. Many students, like, they try to keep the timer in front of them when they are presenting, because they think that they will come to know when to finish the task, and in the later, like if they are running late in the later part, they can just hurry up. But that's not going to help in the exam. In exam, you should know how much to speak from your practice, so that you know that, okay, I've spoken this much, now time is just going to be over, right? So this you can only achieve if you are practicing from the very beginning without the timer. So don't try to time yourself in the case presentations. When you are practicing on your own, when you are reading, when you are trying to like practice at home, then you can actually see how much time you are taking to speak about the history, how much time you are taking to talk about the diagnosis, because that is the time where, if you are going beyond time, you can actually decrease, you can actually practice it again and again, so that your time becomes normal. But once you are presenting it here in the class, don't try to time yourself, right? That's a practice you should do for this particular exam, because 10 minutes is the biggest hack in this exam. Mind you, if they remove the cutoff of 10 minutes, then everybody will pass. Everybody will pass, because everybody has a good knowledge. But the thing is, you have to give that knowledge to the patient in those 10 minutes only. And that's the very, very important thing to remember. Now, this is the syllabus, nothing new in this. We all know about these modules. We all know what is included in which module. So just we will also go in the same way through the various modules, right? Now, as I said, it's 10-minute hack. So basically, 10 minutes timer is the most important thing which you need to take care of when you are preparing for the exam. So practice is the only key, and the practice makes the man perfect, because this is one thing which is going to help you speak in the exam in a proper way, what to speak in a time, in a concise way. That's a very, very important thing. So it's not about knowing much. It's about how much concise you can be, how much you can summarize, and how much effectively you can put your information in the least time. That is the person who is going to win this journey, who is able to present the concise things in a clear way, which can easily be understood by the patients. Now, what is tested in this exam? So we have seen that we have 14 stations. Every station will be tested on either 3, 4, or 5 of these domains, right? So here you are marked for not getting a correct answer, like ticking a correct answer or a wrong answer. It's about these domains. The sheet, the marking sheet which the examiner has, he will have certain points about the patient safety. He will have certain points about the communication with patients and their relatives, certain points about the communication with colleagues, then information gathering and applied clinical knowledge, right? So they will have these points arranged according to this pattern. And then when you start speaking, whatever point you have talked about, he'll keep on ticking those points. And whatever you have not talked about, that will remain vacant. Now, once they have gone through all, once you have finished the station and they have ticked all the points which you have told, then they will see like how many points of patient safety you have covered, how many patients points of the communication with patients you have covered. And accordingly, you will be marked for the various domains. So how we have to cover this thing? So while preparing for the stations, it is not just important to talk about that station properly and cover the management diagnosis properly, but it is also important that we see that we are covering all these domains when we are speaking about it. So for that, what is important is that from the very beginning, when you are preparing yourself, you should be very clear what comes in what domain, how, for what points I will be marked in any particular domain, right? What I will speak so that I get marks in patient safety. What I should speak so that I get better marks in the communication with the patients. So if you have a clear basics about this, if you have clear basics, what is included in what domain, and there are certain general things which you can always speak in all the stations to gain the basic marks. Okay, so that's very important. So when you go to your website, in your website login, your website account has all the modules. The first topic you see is the understanding domains, right? You may think it as a very basic thing, but that basic thing will form a foundation of your journey, because that basic information is important, because that will tell you what is to be covered in various domains. With those basics, at least you have covered 60-70% of the points. And then every station has some specific points. Like if we talk about history, there are basic history templates, and then there are certain points which are required according to that particular topic. So that 20-30% information we will add on to as we go through the various modules. But at least your 50-60% task is done if you know what is to be talked about in any particular domain. So it's very important that you cover up the initial part of understanding domains very thoroughly, right? So in first 3 days, I have marked 21, 22, 23, 3 days for the understanding domains. So you all can go through the videos, and in that there is a homework also, which you can actually send with the recording, so that I can tell you what type of improvement or any feedback about that we can always talk about. So that is how the first section of your website, you will find understanding domains. And please don't skip it. Give those topics a proper time, okay? Because they will form the foundation of your journey. And these are domains like patient safety. We have like talking about the allergies, talking about the cervical screening, talking about contraceptive methods, checking the name and age of patient. These are the general things. Communication with the patients and their relatives, how much simply you can communicate with the patient in a layman language. You are not using any medical jargons. You are empathetic towards the patient. You are not judgmental. So there are good communication skills which we need to talk about. Communication with colleagues, who all you are going to involve in this particular case. Because see, we can't do everything, right? So what we have to identify where we need help. where I should tell my assistant to do that, where I should refer the patient to the other specialist. So these things are the communication with the colleagues. Information gathering is your history taking. Of course, we all have presented the cases in our MBBS and PGs also, where we always take the history. But here it is, we have to see that we are going in a very structured way. There are some rules about the history taking, that is starting the history with the open questions, then asking the closed questions according to differential diagnosis in your mind. So these things we will be talking about in the information gathering. Finally comes the applied clinical knowledge. It's also very, very important part. So there you have to talk about why you come to this diagnosis. You have to explain the diagnosis and then talk about the management options. So these things we have to talk when we are presenting the station. So all of these domains need to be covered. So when you go through the PDFs on your website, you will find that they are color coded. Okay. The different colors has been used for, you will find the different lines with the different colors. What does that mean? Because there is a specific color for the information gathering. So when you are looking at the template, you know that these are the points which are important for the information gathering. When the sentences which are marked by red, you can know that these are patient safety points. So if I'm going to miss this, then I'm going to miss the patient safety point. So as you go through the PDFs, you will come to know what all points are included in what domains in that particular template or that particular station. And it is very important to take care of these things, because finally it is important that you pass in the domains. Passing through the stations is important, but if you are like passing through the stations, but you are repeatedly lagging in one particular domain, right? If you are repeatedly lagging in patient safety, then it becomes a problem. Okay. One domain can still be, still they will allow you to pass if you have done the station and you are clear pass in the stations, but one domain is affected, still you can pass. But if two domains are affected, then they do not allow you to pass, even if you have done the stations nicely. So this is a very, very important thing, that we should understand what are domains and what are the points included in these domains, and any specific points which we need to talk about in any particular station. So what is the strategy? How the things are going to be? Let's make a plan. So how do we approach? We will first start from 2 minutes outside the station. What we need to do for 2 minutes outside the station? How do we prepare ourselves for the best? And remember, these 2 minutes are the very important thing. It's not about just reading the task. It is about making your mind for how you are going to work for next 10 minutes. If you miss this 2 minutes opportunity, then that 10 minutes opportunity is missed. It's simultaneously missed. You will not get opportunity, or you will not be able to take the maximum benefit of that 10 minutes, right? If you have not prepared yourself well in first 2 minutes. Then comes the introduction and setting the stage. This is very important, although like you may find that this is a silly thing talking about the introduction, but yes, this is very important, because these are the points where you are actually checking the name and age of the patient and building a rapport with the patient. So from here onwards, from this particular introduction, where actually you are making a good impact on the examiner, if you are doing it nicely, and simultaneously you are also you have started gaining marks for the patient safety, because you are checking the identity, and because you are building the rapport, you are also gaining marks for the communication with the patient. So two of your domains start right away from the introduction. So it's also very important. Then coming to after that, as we proceed, we set agenda. Then we do the information gathering and history taking, explain the diagnosis, and then followed by the management plan and conclusion. So if we break the station into these parts, right? So it is a very helpful technique to understand how much time to spend on one particular task, so that we finish the complete task in 10 minutes, right? It is very, very important. So how we go about is like, we will start with fixing the introduction, set agenda, and conclusions, right? So what we do is, first we try to fix the introduction, set agenda, and conclusion. This all you will find in your understanding domains topic only, right? So introduction, set agenda, and conclusion should be very much fixed. Then you talk about the history taking, you talk about the diagnosis, and then you talk about the management options. So all this we cover one by one, and we will be focusing on how much time to spend on each of these. So as you go onto the website and you see your modules, you will see the topics like this. You will see the first topic in every module is expected stations. Then there are videos, certain videos, 3 videos, 4 videos, 5 videos. They talk about the basic templates and they talk about the explanations of the common scenarios and their treatment options. So how to explain these particular things which are included in that particular module. What are the management options which we can talk about here? How to explain the diagnosis. So these all things will be covered in those videos. So once you go through that videos, you will have a fair idea of that particular module. Patient information leaflets are posted in the same module in the download section. Usually whatever video you are viewing, the information leaflets related to that you will find there, or you may find the information leaflets actually in the expected stations. Where you see the expected station, below that in the downloads, you will find all the information leaflets for that particular module. Then there are live session recordings, right? So live session recordings are there in which you all will be presenting the cases and feedback will be given. And we will also talk about the standard template, right? It's not about just your case presentation and me giving feedback. It is also about that once you finish, we will go through the standard template as well. So that what is the right answer for that question, that also you come to know. Right? So standard templates are also provided for all the stations which we will be discussing. And finally, with every video session and below every live session, you will find a Google Drive link which goes to the PDF, and the PDF of that particular video, the PowerPoint presentation behind that video, that PDF you will get in that particular Google Drive link. So this is how you can utilize your website. First, see what are the expected stations. Then you have to go through the patient information leaflets and then start watching the videos to get the idea about that particular module. And then I will give you the stations, what stations we are going to discuss in the live session. Those stations will be posted at least 2 days prior to your class so that you can revise, you can come prepared to the class. That is very, very important, because once you are prepared for the class and then you talk in the class, then I can give you the exact feedback for the improvement, right? It's okay if you are not prepared for any station and you can take up the random stations sometimes also, because that is also very important. Because in exam, things will come randomly, right? This time many new stations were there. So if you are not accustomed to presenting the new stations, then again, it's a problem. So sometimes you may actually pick up the random stations as well and try to present that, right? So how to get most of the website? So you can see this first section, you can see expected stations and the patient information leaflets. So here, all the stations which are expected from this particular module are mentioned. And in the download section, there are patient information leaflets. Then you can see the sub-fertility module has the basic template and talking about the unexplained infertility. Then how to talk about the male infertility scenarios, how to talk about single parent, the female infertility scenarios. So like this, the basic topics are there, which you can study. So before coming to live session, as I said, it is good that you go through the patient information leaflets, you go through the basic videos, so that you know that how to go along with the station. And second thing, whenever it's your chance, please take the opportunity to present the case. Because if you are going to improve only by the presentation, if you are feeling shy and you feel that I should not speak, I will speak wrong, what everybody will think, that should not come up, because we are learning. And part 3, the only way of learning is the active presentation. No matter how many mistakes you are making, but if you make the mistakes here, you will not make mistakes in the exam. And it's always better to make a mistake in the class rather than making a mistake in exam. So please, whenever it's your chance, whenever it's your turn, take your opportunity and present the case. Everybody will get the opportunity to present the case for every module. Sessions, already if you have seen the schedule, then for every module I have kept 2 days, right? So we will be having a class in the afternoon, 3:30 p.m. and 9 p.m. at the night also. So you can choose your timing, right? Whichever timing you are comfortable with, you can join accordingly, but try to join the session whether either in the afternoon or the night, so that it's okay if you are going to listen to the recording of that, but at least take the opportunity to present your case, right? Don't leave it for the others, like everybody will do, I'll just listen the recording. That's not a good thing to do for the part 3. So therefore the classes are scheduled at 2 different times. So those who are comfortable with the afternoons, they can come at that time, and that will be Indian Standard Time, 3:30 p.m. For GMT time, it is, I think, around 10 a.m. in the morning. And when we are doing the night class, that is 9 p.m. India time, then it is around, I think, 3:30 p.m. in the GMT. So whatever time suits you, already the days are marked in the schedule. So you can mark your calendars so that you know how you can adjust your work to get to spare some time for the active presentation. Okay, so that's the very important thing. What all we will be doing in the course? So we follow the read, revise, and recalls. So you are reading, then we are revising in 24 live sessions. Every module, 2 live sessions are there, right? More number of students, we need more live sessions, then we can include more live sessions as well. But at least 24 live sessions will be there. There can be more sessions also, depending on, so that every student gets an opportunity. So after we finish all the modules, in last 2 to 3 months, we will be doing the recalls. In the live sessions also, whatever stations we are taking, they are mostly the recall stations, right? And then further in next 12 classes, we will be totally taking up the recalls, right? So we'll try to cover every recall possible from 2015 till date. Okay, so we will cover all the recalls. Only thing is that, like, if any for any particular topic, there are 5-6 recalls, 5-6 times it has come up in a slightly different way. So we can take up that topic once, okay? But for the topics, we will be covering all the recall topics included in all these live sessions. Finally, when we are nearing the exam, almost 1 month before the exam, a link will be posted where you can go and schedule your 7-station mock. And this will give you a practice of how you can go along in the circuit, right? So that is also a part of the course. In between all this, whenever you feel you need to talk to me, you need to discuss with me about your exam preparations, you have 2 hours one-to-one mentoring sessions also. Link will be there in the group where you can go and schedule your session. And if any time the link is not open, or it is not showing any schedule, then you can just text me, and we can just fix up another time, and we can go for this one-on-one mentoring sessions as well. So this is how the course is going to go about. Any questions from your side before I proceed further? Anybody, any questions? No questions? Everything clear? Yes, no, anything?
Hello, ma'am.
Yeah.
Ma'am, just a question. Is it better we just go through the guidelines briefly before we start each module and the patient leaflet information?
Mhm. See, guidelines, we don't have to go through the guidelines in a very much detail. We can go through only the bold things in the guideline. That's fine if you want to revise that. And patient information leaflets are more important because they are new things, right?
Okay.
So
Okay.
that is more required. Of course, the
And,
information in the patient information leaflets is also same as in the guideline, but it is in the language which we have to speak to the patients. Fine. Everybody okay? Okay. So, as I said, station practice, that is the case presentation, need to be done by everybody. How we will be practicing? First thing is that you go for the 2 minutes outside station. So, first thing is you should learn how to utilize those 2 minutes. Who you are, where you are, to whom you are talking. That's a very important thing. When you are standing outside the room, first thing is who you are. See, it's a acting. It's a drama which you are going to play there, play any role particular in that particular scenario. So, like you are ST5, you are who you are going to talk to your junior, to a patient, or to the consultant. So that will depend on what type of station it is, right? So for that, you will have to see to whom you are talking to, where you are. You are in the labor ward, you are in the antenatal clinic, you are in the fertility clinic, where you are. What is your task? What is the task given to you? Because you something else is given to you as a task and you are talking about something else. Your effort goes waste. So you should be very clear what you want to achieve in this 10 minutes conversation. What are the domains tested? That's another important thing. And the broader outline according to domains. Like I said, we have some basic points for every domains and some specific points for domains in any particular station. So when we are standing outside, we have to focus on what is specific in this particular station, right? So if you have made a outline of this thing in the first 2 minutes outside, then it becomes very easy as you go inside. So first starting with the 2 minutes outside, then we have to go for 1 minute introduction, which we will practice to cover up in 1 minute. That will come when we speak again and again, again and again. So we fix our introduction in less than 1 minute. Try to save our time. Then 3 minutes is for your history taking. This is a difficult task because many students actually struggle for the history taking. They just are able to complete the history taking in 5 minutes or maybe sometimes more than 5 minutes. Then it is impossible to complete the task, right? So you have to have your history taking in 3 or maximum by 3.5 minutes, right? If you are going too long, then you are wasting your time and not able to achieve the target. 1 minute to explain the diagnosis. Another challenge. People take long time because they will start explaining, then they will come to the diagram, then they will again explain. So all these things we need to work on. And then 3 minutes for the management plan. And finally, 1 minute for the conclusion. So this is how we are going to utilize our 10 minutes. So this is how we have to go about. Now you see that when I have talked about the station timing, so I've given you 1 minute, 3 minute, 4, 5, 6, 7, 8, and 9. But actually in exam, you will get only 7 to 8 minutes because role player will also speak, right? So you have to leave that time for the role player also. So it is important that we know that we should be able to complete the station in 7 to 8 minutes. It's actually not 10 minutes. It's only 7 to 7.5 minutes because rest of the time will be taken by the role player. Now, understanding the scorecard. So for every domain, you will be marked. So for every domain, you will have 2 points, 1 point, or 0 point, right? So now if in one particular domain, you have 10 points. If you have done 80% of the points you have managed to speak, then you pass in that domain and you get 2 points. if you have managed to speak 6 out of 10 points, that is almost 60% of the things you have covered, then it becomes borderline, right? So you get only 1 mark. If it is 5 or less than 5, then you fail. If you are below 50%, you fail. So this is how you will be marked for all your domains. And in total, throughout the circuits, if I count, 70 domains will be there. 70 domains will be marked. Now, what are the type of stations which you see in the exam, right? So what are the various types of stations which you have in the exam? So first is the simulated role player task, right? Simulated patient task. So this is the biggest chunk. Simulated patient task is the biggest chunk, which is the role player stations. Now, in simulated patient task, I have marked this red cross. So basically, because if I talk about the simulated task, you may have simulated patient task, and you also have the simulated colleague task, okay, where the colleague is in front of you and some junior is there and you are teaching. So those are the teaching stations. So these are the bigger chunk is of the simulated. Then there are lay examiner station, which is again the simulated patient task, but you have a lay examiner as well, along with the clinical examiner. What is the role of lay examiner? Lay examiner is a non-medical person sitting there, and he is just looking at your conversation, how you are talking to patient, how you are explaining to the patient. So all these things are there. So basically, as you are talking to the patient, the way the empathy you show, the more the non-judgmental you are. So all these things, the examiner will judge you and he will mark you according to that, whether if he need to go to you again, would he opt to go to you again or would he not like to go to you again? So accordingly, will give you marks. So 4 simulated patient tasks are the lay examiner stations. Now in these stations, lay examiner will give you extra marks out of 4. Okay. You will get the clinical examiner marks, but lay examiner will give you extra marks. Okay. So these 4 stations, in those 4 stations, if your communication with the patient has become all the more important. So if you are explaining properly about the communication with the patient, if you have done properly, then you can get those extra marks, right? So 4 marks in 4 stations, 16 marks, a big chunk, right? So your communication skills can actually make you pass in this exam. So that's a very, very important thing to know. So therefore, this all practice which we are going to do, we will keep on focusing for the communication with the patient in a very, very effective way so that we don't lose these marks. Because this is something we just need to do. There is no knowledge needed about it, right? So even if we don't know anything about the station, still we can demonstrate our communication skills. So this way, this helps in passing the exam effectively. And then there are structured discussion tasks, which are more of like vivas. As we used to do in PG days, like you are sitting with your consultant, you are given a task and you are going to talk about it. This particular thing, if you see, then this is the role player and this is the examinee. This is the clinical examiner and you can see one more person here, right? This person, she is the lay examiner, right? So this is how the lay examiner station will look like. If it is a without lay examiner simulated patient task, then the patient, clinical examiner and the examinee will be there. Another task where this person, instead of patient, she can be your junior. So junior, clinical examiner and you are sitting. In the structured discussion task, only you and the examiner are there. There is no role player or no lay examiner. So this is how the number of people in the chamber are there. So you will have only you and consultant in the structured discussion task. In the simulated patient task or simulated colleague task, you will be 3 people like you, clinical examiner and the role player. While in the lay examiner stations, you all will be 4 people because the lay examiner will also be there. What is the recommended reading? So as you just asked right now, like I need to revise the guidelines. So you just have to touch the guidelines, okay? Because you just need to remember the important things, not to go through word by word. No need to spend so much time for that. But patient information leaflets are something new, and they are very important because many of the stations are actually going to be the simulated patient task. So for those, all we need the patient information leaflets and their information. Secondly, in structured discussion also, sometimes they ask you, like, how will you explain this to the patient? How will you consult the patient regarding this? So actually what you are asking is how you will talk to the patient. So it's the same communication skills will come up here. What are the challenges and the common concerns? Why do people fail? So first thing is language barriers. So you have to be like, you should be able to understand the extent of the role player. Now, depending on your location where you are choosing, the role players may have different accents, but actually we need to know what must be coming from the role player, right? With a small amount of background knowledge, you can easily decipher what the role player wants to say. But your English speaking skills need to be good enough so that you can speak fluently and confidently. You should look to be confident. Ineffective communication. You are talking, you are explaining, but it is not going to the role player. So that's not going to work. Role players should be able to understand that, right? So it should be very clear information and very concise, and only the thing which is required is being explained to the patient. Inconfident. Never look inconfident in exam. Even if you don't know anything about the station, still follow your basic template and remain confident. Time management is the most important skill in part 3. Many people struggle with that. Patient safety, the most commonest domain where people fail. But the important thing is, whenever you are doing the stations, see what are the important patient safety points in this station and remember those points. This is very important. And in the last, yes, inadequate knowledge. If there is a knowledge gap, particularly if there is a knowledge gap for majority of the stations. If there is a knowledge gap in 2 stations, 3 stations, that's fine. It's manageable, right? But it should not happen repeatedly in majority of the stations. And to manage all this, I always recommend that you should make 1-page notes, right? So what does this 1-page notes mean? Whenever you are doing any particular station, then you can just write like what are the points in the patient safety, just one word, right? How I am addressing patient safety in this particular station. If I'm talking about communication with colleagues, who all I'm going to involve in this particular station. So just make the 5 columns. What is important in the history taking? What is important in the communication with the patient? What is important in the communication with colleagues? So like this, you can make a list. When we will be talking about the stations, we will be talking about like how to make these notes, and there will be some examples also in your PDFs. So finally, with knowledge, your personality development, like how effectively you can go and talk, and with communication colleagues, it becomes very easy to pass the exam with good time management skills, right? So that was all about which I need to give you the information regarding the part 3 format and how we are going to talk about this format. You don't have to see the whole staircase right now. Just take your first step. So start from understanding domains, and as we move forward, we will be talking about things in more details. Now it's open for your questions. Yes, any questions from anyone? All well? Everything fine? Everything clear to everyone? Anything you guys want to say? Part 3 is all about talking, right? And everybody is so silent. Okay, good. Thank you, Dr. Madhuri. It's clear.
Ma'am, I have a question.
Yeah.
Ma'am, can you guide us from it is November going and 20th has already passed. So up to May, from now onwards, with our study partners, how many tasks should be done daily to have a practice and for having a good time management?
It's quite a lot of time right now. So you can start with 2 to 5 stations. That's fine. But that you can do because you have already done the stations once. But for the newcomers, I don't expect them to do even 2 stations daily. They can even start from 1 station daily. First thing is that for the newcomers, it is important that you first see how the stations are created, right? How we have to cover up the different parts of the station. But those who have already been practicing, they can go ahead with the 3, 4, 5 tasks. That's enough.
Okay.
Because right now you can work more on improving the quality of the task rather than bothering about the quantity. Quantity will be more important when you are reaching like February.
Okay, ma'am. Okay, thank you, ma'am.
Welcome. It's clear, all good. Thank you. Clear. Everybody okay. Fine. So that's all for today. And meanwhile, we'll keep on communicating in the Telegram group. There is a schedule already posting, but day-to-day schedule will also be posted. And the first module we are going to start is the self-fertility. Right? So we'll meet again in the next live sessions. And you can please mark your dates for the live sessions. And so that please try to join actively in the sessions. Okay? Bye-bye. Take care and good night. Good night. Thank you.